Welcome back, Dr. Ian here. We were just talking about you being treated as a number and not, again, treated as a interconnected set of systems. So understandably, when you have these chronic symptoms and you're not seeing the relief from medications, the next step is, why do I have that condition in the first place? Well, one of the basics behind that, right, is that you have inflammation. Again, we mentioned these symptoms, the brain fog, the joint pain, fatigue, stiffness, right? Short-term memory issues, GI problems that are chronic. This is really boiling down to inflammation. And like I said, the majority of people with a thyroid-based issue are really dealing with an autoimmune issue, meaning that your immune system is physically actually attacking your thyroid tissue and you are developing chronic inflammatory symptoms from that. There are no medications that are currently actually treating this because you're not actually treating your immune system. So we want to understand how your immune system has broken down, and especially we want to understand that there are systems, right, that are then causing symptoms. And when you start to understand that aspect, that's actually how functional medicine works, is we're understanding your physiology and how that broke down, how that led to the actual place that you're at right now. And again, you can't drug yourself healthy, so you're not going to be taking a medication to actually fix the systems. They want to medicate your symptoms, i.e., the additional medications that you get put on, and people yet still struggle to have, again, relief from their chronic issues. So again, back to what we're talking about, right, is that autoimmune, and especially when we talk about Hashimoto's, it's so important because as soon as you have, again, this positive TPO or a positive thyroid globulin antibody, now what we're talking about, those are the antibodies that are tagging your thyroid gland and bringing in white blood cells to destroy your thyroid gland. So what we have to do is say, hey, look, how does this process start in the first place? Well, it's going to be through genetics, right? Genetic predisposition, okay? There's going to be something called environmental factors, okay? And then 3, it's going to be triggers. Now, those 3 things actually combine and form something called leaky gut. And leaky gut is actually how people then go on and develop that process where you create antibodies against thyroid tissue or antibodies against other tissue. Because as soon as you actually have a diagnosis where you know that you have Hashimoto's, guess what? There is a 50% chance that you will have a second autoimmune disease at the time of that diagnosis. So this is why we want you to move your feet, because again, we know that as soon as there's 1, there's likely 2. When there's 2 confirmed, there's likely going to be 3, and then on it goes. So we don't want to ignore that. And you have to start to understand, hey, what is my genetic predisposition, right? Do we have issues with this gene called MTHFR? That's one of my biggest concerns, is do you have abnormal MTHFR status? This is an enzyme, and it actually relates to B vitamins. But when you can't make these activated B vitamins, guess what? You start to increase a marker called homocysteine. And when homocysteine, which is an amino acid, goes up, you get decreased blood flow, right? So we get decreased blood flow. And that includes to your brain. So things like cognitive dysfunction is exceptionally common. It is the rule. It is not the exception as it relates, again, to thyroid pathology and thyroid disorders. This is also, by the way, why we measure homocysteine on blood work, because we want to know that is also an indirect marker of inflammation, of vascular inflammation, and again, of how well this gene is working for you. Secondly, we have those environmental factors. Well, again, if you look at plastics, okay, a chemical called parabens and phthalates. Now what we're talking about, right, is these are called persistent organic pollutants. Environmental chemicals can disrupt your immune system and increase the chance that you develop, right, Guess what? Autoimmune disease. This is why it's so important that we eat organic. This is why we coach you around your environment and what you may be exposing yourself to. This is why we give recommendations as far as how you can eat and you can live more in a clean way, because these chemicals can directly interfere with your immune system and they can cross-react with your thyroid tissue as well, being another mechanism for autoimmune disease. And triggers are probably the most important thing here, right? Because these triggers are what's directly influencing and actually driving that leaky gut process. And what's crazy, right, is that when you have leaky gut, you can increase your risk of autoimmune disease by 30-fold, meaning you are 30 times more likely to develop an autoimmune disease when you have leaky gut. Yet your doctor is not testing you for leaky gut. They're not looking at the triggers behind leaky gut, because those triggers are the same triggers that drive inflammation, and then that drives the dysregulation of your immune system, and that's why you begin to attack your thyroid tissue. Believe me, you can medicate your thyroid as much as you want. You can treat, remember, your TSH, and you can have a perfectly balanced TSH and be miserable because you're not actually, again, going after the source of the inflammation. So these triggers, which are very consistent, very common, one is going to be something called dysglycemia. Okay, and what's really important about that is if you have fatigue after meals, you crave sugar after meals or salty foods after meals, there's a very good chance that you have dysglycemia. And what's happening with there is that's driving, right, insulin resistance. Now, insulin resistance, and this is the hormone connection, right? Insulin resistance, right, drives hormone, right, dysregulation, because insulin itself, okay, drives fat cells. Fat cells drive estrogen. So what's going to happen here is that not only will, again, people with Hashimotos have inflammatory symptoms on a consistent basis, but they also tend to have estrogen dominance issues until they go into perimenopause and menopause. And then they actually drop and dip in estrogen, which is another time period when women actually suffer with thyroid disease. But hormones here are critically important because they actually influence your immune system. They become another inflammatory trigger, which again was why we want to know, do we have dysglycemia? Again, blood work is where we cover that piece. Do we have hormone dysregulation? We use, again, saliva or urinary measures of hormones because that is more consistent with what's available at the tissue level. Remember, your doctor may have tested you via your blood for hormones. That is not the full picture, and we need better information to know exactly what's going on here. Another very consistent issue that's going to be a trigger behind leaky gut and therefore autoimmunity is going to be something called dysbiosis. And dysbiosis just means the balance of bacteria in your gut. You may know this or you may not, but again, there's a very good chance if you have an autoimmune disease that at a younger age you were exposed to antibiotics. Maybe you were exposed to multiple antibiotics, right? Your sinus infection or your ear infection or tonsillitis, whatever it was, right? Maybe you had acne that was treated with antibiotics when you were younger. Whatever happens, if you wipe out the good bacteria, you are creating a huge platform and open, right, with open arms to the negative bacteria. And that negative bacteria produces inflammation, it decreases absorption of critical nutrients, and it changes the inflammation in your gut. But guess what? What happens in your gut? It doesn't stay in your gut, baby. It isn't Las Vegas. And so what happens, right, is now you've got this permeability, that barrier gets disrupted, and now you've got things moving through that gut barrier that can then, again, cross-react against thyroid tissue. So again, if I hear that there's a history of IBS, I'm very concerned about dysbiosis, right? If you've lost your gallbladder, you are exceptionally, right, increasing your risk for dysbiosis. If you've had a diagnosis of anemia, again, strong case can be made that there likely is dysbiosis. And if you have gas and bloating after meals, then again, you have fermentation. That fermentation is likely coming from abnormal bacteria, and you need to test. We need to test and start to understand where is that inflammation coming from, right? Because until you understand and find the triggers, is it dysglycemia? Is it hormone dysregulation? Is it dysbiosis, right? Until you find the trigger, you can't treat the cause. And that cause is what's causing the symptoms. So again, I encourage you strongly right now to start taking a different understanding, a perspective of what I'm trying to give you from functional medicine, which is you can think and link the systems that are causing symptoms, or you can try to name it, blame it, and tame it. But I'm going to ask you right now, how well has that worked for you? Again, using medications per the symptoms, rather than starting to realize that maybe it's your physiology that's altered that is then ruining, right, the quality of your life, robbing the joy from your life. And we want that joy to be back in your life. We want your symptoms to be resolved. We want you to have normal physiology. We want you to feel like you're in control. But it's only you who actually will really move your feet and take control by taking the next steps. And that is through our initial new patient evaluation. That will be done, right, through a first discovery call with our staff, talking to you about what's going on, understanding your history and your background, right? Getting you our consultation, which will again include a LabCorp blood work, right? And that whole process is $199. So we truly believe that if we get down into your root causes, we resolve the inflammation, we improve the quality of your life, you are going to get excited about your life again. And this is what I've been seeing for the past 17 years. We have over a 90% success rate with our thyroid patients because we're not treating you as just a person with a thyroid condition. We're treating you with someone who has complexity between systems, and so someone who wants to be taught and educated about what they have to do now, next, and forever to maintain your optimal health. Again, my name is Dr. Ian. My practice is called Dr. Autoimmune. Again, I strongly encourage you, click that link below, grab your discovery call with staff, and I can't wait to see you on the next side of this. Dr. Ian, Dr. Autoimmune, let your health soar.